Obulamu, 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 obulamu.
Most of the diseases and conditions in Uganda are largely preventable with the right information. And simple, everyday health practices can lead to a good life for the whole family. It is against this background that the Communication for Healthy Communities project was created.
Uganda Health Marketing Group started a partnership with the Family Health International 360 FHI when we won the bid of the Communication for Health Communities project, which was a USAID 5-year project. The CHC project was a consortium. The prime organization was FHI 360. Uganda Health Marketing Group was the sub-partner. We've worked together to support the government of Uganda and US government implementing partners in this country to design health and innovative communication campaigns.
We have 6 thematic areas that we focus on: family planning, malaria, nutrition, HIV and AIDS, maternal and child health, TB. There are some issues that are cross-cutting, such as water and sanitation. Those come in handy in some of the areas we cover.
The relationship has been very smooth for the last 5 years, running the CHC project, which has an innovative campaign called OBULAMU, which is How is Life.
And the idea behind OBULAMU is that by making health part of day-to-day life, people can open up and share so much more about their life, and they're able to introduce a lot of health issues that people can address, from preventing HIV to going for mental care to delivering at the health center, eating right and staying fit to prevent disease and promote health.
In this project, Uganda Health Marketing Group under Communication for Healthy Communities has since 2012 implemented 3 nationwide campaigns: the Saving Mothers Giving Life Initiative, the National Condom Promotion Campaign, which focused on reducing HIV infections, the Elimination of Mother-Child Transmission of HIV campaign.
It was 2012 when the First Lady re-engaged effectively in HIV and AIDS. She decided to call a national workshop for all stakeholders in Uganda. Everybody was involved in EMTCT. And then she wanted to know how she can add value. After that workshop, they requested her to be the champion for EMTCT, and she accepted.
When we began the Adhan One campaign in Tungamu, which was the first launch, and we worked with them to do 10 other launches across the country. There were mass media, community mobilization campaigns, again addressing high levels of children that get born when they're HIV positive.
At the time, the slogan was "Have an HIV-free baby." We developed additional content in terms of television adverts, talking points for leaders. We engaged the media people, engaged the VHTs. We engaged different leaders at all levels, cultural. I remember us engaging the Munyoro King, Emorimori, the Nabagereka at the cultural level, and then we had religious leaders that we worked with.
The First Lady ministered the first dose, as we launched this campaign. And at that time there was a lady who was pregnant with twins. And during our last campaign in Chiruhura, they brought these twins. They were like 2.5 years, and they were healthy.
Uganda made great progress with this campaign, and the following highlights registered. There was a dramatic reduction of new infections by 86%. There was also a reduction in babies born with HIV from 15,000 in 2012 to 8,000 in 2014. This historic impact led to Uganda being globally commended for realizing the global plan milestone by reducing the transmission rate to 2.9%. The National Condom Promotion Campaign, which focused on reducing HIV infections, was leveraged on the Smart Choices and the UNFPA funded If It's Not On, It's Not Safe condom campaigns.
UNFPA was funding a communication campaign dubbed If It's Not On, It's Not Safe. And so CHC came at the right time when the funding for that project was ending. And so CHC adopted some of the materials that the campaign had already done, because it was already a popular campaign among the young people. So we got some of the materials and started using them in CHC activities. But in addition, CHC also produced additional content under that project. If it's not on, it's not safe.
We have worked with a number of communication bodies, particularly the UHMG, to look at the risk perception. Once people realize they are at risk, they're able to take on prevention activity. And most of those who take on a prevention activity, they go for condom. We've been developing materials together, making sure they are cleared through the Ministry of Health and through Uganda AIDS Commission.
To promote the total market approach, Uganda Health Marketing Group worked with the Social Marketing Activity Project to increase access and availability of free, social marketed and commercial condoms during community shows and activations.
I find UHMG a very exciting model, largely because social marketing and social behavior change communication are like Siamese twins. One of them is to make sure that you change people's behavior for the social good. And therefore, with our social marketing techniques, to bring products, to bring services on the table, helps people who have sustained behaviors to utilize them. And so, going forward with our social marketing activity, which is also a 4-year prime project, we are using exactly what we've learned and unearthed under the CHC project to bring forward social marketing to a sustainability angle.
Communication for Healthy Communities, furthermore, facilitated the development of the new 2017-2021 National Comprehensive Condom Programming Strategy and Implementation Plan.
I'm proud that we can talk about condoms on air. When I started, I remembered one time I was with this DJ Berry, and we said, you have 3 choices: abstinence, faithfulness, or and it was cut. Condom use. Condom use was not very welcome at that time.
The National Condom Promotion Program in Uganda significantly contributed to the reduction of sexually transmitted infections, including HIV, and unintended pregnancies by ensuring that all sexually active individuals in Uganda have adequate information, access, and correctly use quality condoms whenever they need them.
Condom uptake has really gone up over the years. As we talk now, if we're going full blast, if the condoms are there, we go over 240.
The Saving Mothers Giving Life Drive was an initiative supported by the governments of Uganda and the United States that aimed at dramatically reducing maternal and newborn deaths in 10 targeted districts in western and northern Uganda.
So many women die when they are giving birth. They delay to go to the health center. That if you don't go to the health center when you're pregnant, there are too many risks and you're not in control. Anything can go wrong about the pregnancy or about the mother, the pregnant woman herself. So the SMGL focuses on saving those mothers when they are giving birth or when they are pregnant.
The journey of Saving Mothers is premised on reducing maternal mortality, but it looks at 3 delays that cause maternal mortality. So the first delay is at the household level. The second one is at the community level. Then the third delay is at the health facility. So when CHC came in, we added these areas and started developing materials together with the partners and messages that would address these issues that were preventing mothers and couples from accessing services and also delivering in health facilities.
The OBULAMU How is Your Pregnancy campaign combined interpersonal communication and mass media communication interventions in local languages that focused on improving knowledge, motivation, and addressing the underlying gender and social norms at a household and community level. Throughout the project's lifespan, there was continuous review of existing data and research, which established individuals' knowledge, attitudes, and social practices in relation to various health issues. At the completion of the campaign, the Saving Mothers Giving Life initiative achieved remarkable results. of reducing maternal mortality by 45% in health facilities and an impressive 41% in 10 districts. Close to 60,000 people had been reached through locally adapted interpersonal communication interventions, like the community dialogues, pause dramas, community shows, and home-to-home visits. Nearly 3 million people had been reached through radio and TV broadcasts, and over 90,000 people had been reached through social media.
I think the major successes really are that people know. It's awareness. All our results show that awareness is from 80, 85 to 90%. For EMTs, it is over 100%, that people know that I can give birth to an HIV-free baby even if I'm HIV positive. For prenatal care and mothers giving life, it's again about 85 or 90%, which is very good for us because people know. Because a lot of times it's what people don't know that actually kills them. So by empowering them with this knowledge and motivating them to do something about it, it's one of the first steps for them to change and do better in life. Of course, the second is that out of that knowledge, people have taken action. We know, for example, from the audience listening surveys that people have done something as a result of knowing these messages, that men and women are talking about these issues in a home, which was not happening a lot before the campaign. And so that discussion in the home makes them plan for the baby, plan to deliver the health center, and also plan for whatever they need in terms of finances and transport to make things happen before the birth of the baby. We also know that they actually go to the health center. They ask doctors, tell us that people come and ask these kind of questions. People come, I saw an OBULAMU message that talks about this and this and this. What does it mean? Because all our messages end by saying go to the health center for more information and for services, and we get feedback from the health center that actually people are going. Over 15% of people, those people that have seen or heard the message are actually going. And this is from the Ipsos listening surveys we've done that we'll be doing every quarter. And that's got some good success. The design of this work always is to work with existing structures, that you don't come and do your things and then run away after the project has closed, but you work with people that are on the ground, local people, community leaders, government of Uganda structures, districts, village health teams now who are becoming community health workers, local partner like UHMG. And so part of that was that you're going to work with UHMG, who are Ugandan organization that's going to stay here after the 5 years, and they're going to stay. And the local staff you work with and the project itself, they stay and keep working in Uganda to address the same problems.
As a local organization, we pray that we have other projects we're implementing. So we are going to use those platforms with the lessons learned under CHC to continue cascading them.
Communication is very, very, very critical. And when you are communicating, you are not only looking at an individual, you are looking at the environment. You are looking at people in the home. So you can spend your money buying drugs, building hospitals, but if you don't communicate, you are basically wasting time. So communication is important, and I'm happy this project CHC came out strongly to address the issue of communication. You've heard this slogan of theirs, OBULAMU. You've seen the outdoor kind of advertising, the billboards. You've seen the drum on TV. This is all trying to bring life-saving messages to the people so that we prevent this avoidable death.
The ministry is already taking on a lot of these interventions that have actually proven effective, and that they're going to be scaling them up with other partners, but also USAID through the many partners who are working across the country. They are also picking up those approaches that have worked well over the years and actually scaling them up and using them to also, of course, they tailor them to their regions, but actually use them to get even better results. So there's a lot of sustainability across the board, right from who you work with and how you work with them, so that you can transfer skills and knowledge and competencies for people to keep doing and using what you worked with.
The best thing that happened to the CHC project was to engage a local partner who is UHMG, and therefore along the implementation, all the lessons that have been learnt, all the innovations that have been brought on the table are going to continue. We have already signed an MOU with the Ministry of Health to design a social behavior change communication center of excellency. The training started last year, and it is aiming at building more SCBCC experts in the country. All the materials that were designed during the campaign, we still have them. And so Uganda Health Marketing Group will continue engaging the USAID implementing partners to be able to utilize them in the different campaigns. OBULAMU, in a way, has an interface of our platform as UHMG called Good Life. So we are going to pick all the lessons, all the models we've been using under OBULAMU to continue running our campaign as Good Life platform. So all those are sustainability models. We are already working with the Ministry of Health on different technical working groups, and we are already sitting on the technical working group of communication. So that is part of sustainability. We are extremely excited about our engagement on CHC and OBULAMU. The new projects which we are going to serve, including the rights projects, we are using what we learned to cascade down on those implementing projects.